And two new studies released this week are giving us a little bit of new insight into the effects of COVID-19 on the heart. Circling back with Brooke in the studio one more time tonight for this new information. What do you got?
Doug, we think of COVID as a respiratory infection, but experts say it's really more of a multi-system infection. And these studies suggest the virus could also have an impact on your heart even after you've recovered.
You know, COVID affects all organs. So the heart is no different than the kidneys that we see involvement, lungs, liver, all of the organs. And that's the very unfortunate thing.
Dr. Toulay is a cardiologist with Texas Health HEB. He says since the pandemic began, they've seen an increasing number of patients suffering from heart failure.
Anecdotally, about 90% of those patients in the ICU end up with some degree of heart involvement.
And two new studies published in JAMA Cardiology are shedding light on the issue. One identified coronavirus in the heart tissue of COVID patients who died. The other found that among 100 adults who recently recovered from the virus, 78% showed some kind of cardiac involvement on MRI scans. 60% had ongoing inflammation.
Are these patients mostly people with really severe underlying health conditions? Are we seeing this happen in healthy patients?
Yes, we are seeing healthy young patients develop COVID-related cardiomyopathies and heart failure. We're seeing the younger population develop heart attacks from COVID, regardless of whether they have pre-existing conditions or not.
But he says, like not everyone who has COVID is symptomatic, not everyone with the virus will develop this complication, which is why he says more research needs to be done.
The good news is a lot of these viral cardiomyopathies recover, so they get better.
Now, as far as the signs and the symptoms to look out for, Dr. Lay says any respiratory stress is a sign that you are not maintaining oxygen levels. So if you're just out of breath from having trouble walking from one room to the next, it is time to talk to your doctor.